Thank you for your attention. My name is Elizabeth Volkmann, and I'm a rheumatologist at UCLA in Los Angeles. And I'm going to talk to you today about nutrition and the microbiome and systemic sclerosis. So before I begin a talk, I always like to go through the objectives, so what we'll cover today. And to begin, we're going to go over how Scleroderma affects the GI tract and some of the unique features of the GI tract microbiome in Scleroderma. And microbiome is just a fancy term for the collection of bacteria, viruses, and fungi in an area in your body. So you all have a microbiome on your skin and in your mouth and all along your GI tract. So we're going to focus specifically on your lower GI tract. And we're going to talk about how the microbiome can vary in patients with Scleroderma depending on where you live. And then the greater part of the talk will focus on nutrition in Scleroderma and some of the dietary modifications that you could consider making to help improve your symptoms. So before I begin, I wanted to give you a little bit of background about why I got interested in this area of Scleroderma. So when I was a medical student at UCLA, I started seeing patients with Scleroderma with Dr. First and Dr. Clemens. And what I noticed is that when patients came into the clinic, we had treatments to offer them if they had skin disease, we had treatments for their lung disease, but we really had nothing for their GI tract problems. We had some medications that could treat some of their symptoms, but nothing got at the root cause of what was going on. But what I did notice is that when a patient came into the clinic and they were taking antibiotics either for a digital ulcer infection or a UTI, a lot of them felt that their GI symptoms improved when they were on antibiotics. And then once they stopped the antibiotics, their symptoms came back again. And this told me, okay, well, maybe there's something with changes in gut bacteria that's underlying the symptoms of GI tract dysfunction in Scleroderma. So then I met this man, Dr. Jonathan Braun, and he was the chair of our pathology department at UCLA. And he was a pioneer in studying the gut microbiome in patients with inflammatory bowel disease. So I went to him as a student and I said, I have an idea. I want to learn about the microbiome, but I'm not interested in inflammatory bowel disease. I want to study patients with Scleroderma. And he was very interested, and he supported me in the first project that was ever done looking at the gut microbiome in Scleroderma, and I'm going to share some of those results with you today. So most of you in here are probably very familiar with how the GI tract is involved in Scleroderma. But for some of you who may not be, virtually all patients with Scleroderma will have some involvement of their GI tract over the course of their disease. And both the upper and lower GI tract can be involved, and we currently don't have any curative treatments. This figure demonstrates the prevalence of involvement. So 70 to 90% of patients will have involvement of their esophagus, 10 to 30% will have involvement of their stomach, 10 to 50% will have involvement of their small or large intestine, and then you can see almost 70% of patients will have involvement of their rectum. So these are really high prevalences when you consider that this disease is very variable across patients. So what are the symptoms that occur when these various parts of the GI tract are involved? Well, if the esophagus is involved, you can have problems with swallowing. We call this dysphagia. You can also have problems with reflux, and this could feel like heartburn. When the stomach is involved, patients can have early satiety, and basically this is getting full really easily even after eating a small meal and experiencing a lot of bloating after eating. When the small intestine is involved, you can have malabsorption, which can lead to weight loss. And when the colon is involved, you can have episodes of pseudoobstruction, as well as diarrhea, constipation, or even both. And then finally, when the rectum is involved, fecal incontinence can occur, as well as rectal prolapse. So as you can imagine, these symptoms are extremely disruptive. And my patients in clinic tell me that out of all aspects of their Scleroderma, even the ones that are on oxygen waiting for a lung transplant, their GI tract symptoms bother them the most on a daily basis. And this is because it affects their ability to take long car rides, to travel in planes, to eat at different restaurants. So it's a huge problem, and it can really affect someone's emotional well-being as well as their quality of life. In terms of what we know about the cause of these problems, we actually know quite little. But this is a slide looking at the muscle of the gut in a patient with scleroderma on the left and a healthy patient. And you can see there's a lot more blue in the patient with scleroderma, and this is the deposition of collagen. So we think that what is happening in the gut is that there's too much collagen, just like the overproduction of collagen in the skin. This causes the muscle to break down, and then the gut stops moving properly. And then as a result of these problems, secondary issues occur. So you can have issues when things slow down too much of obstruction, and then this idea of bacterial overgrowth. So who here has heard of bacterial overgrowth? Oh my goodness, almost everyone. That's good. So bacterial overgrowth can be a huge problem in scleroderma. And antibiotics seem to improve some of the symptoms of bacterial overgrowth. But again, usually these improvements are quite temporary. Once you stop the antibiotics, within a few weeks, the symptoms can recur. And then sometimes you get caught in these cycles of going on and off antibiotics to manage GI symptoms. But actually, there is some evidence now that these changes in the bacteria in the gut can occur early, even before the gut starts to slow down. So there was a study done in France on patients with systemic sclerosis. And they had all the patients coming into the clinic do a breath test. This is the test that we do to look for bacterial overgrowth. And what they found was that in almost half of the patients who didn't have any history of GI symptoms, half of them actually had a positive breath test. So even before there was evidence of GI problems, there was some imbalance in their gut bacteria. So for me, this was enough evidence to start looking at the bacteria in the gut of patients with scleroderma. So the first study that we did was comparing the bacteria in the colon of patients with scleroderma and healthy patients, and then to try to figure out if there were certain bacteria that were problematic, certain ones that if they were present in higher abundance could cause more symptoms. So we recruited adult patients from UCLA, and everyone had to be able to undergo a colonoscopy, and they had to be off of antibiotics and probiotics at least 3 weeks before the colonoscopy. They couldn't have any other GI problems, and then we matched the patients based on their age and gender to healthy controls. So when we were collecting the bacteria, we did it during the colonoscopy when the patient was sleeping, and we collected it from 2 different parts of the colon, the cecum, which is the very first part of the colon, and then the sigmoid, which is the very last part of the colon. And we sampled from 2 different areas because we wanted to know about bacteria along different parts of the colon because it can change. And then we measured how severe their symptoms were using something called the GIT 2.0. And some of you may have filled out, this is a questionnaire that patients fill out about how they're feeling. And it covers these 7 different areas that reflect GI dysfunction. And it was actually developed by Dr. Dinesh Khanna when he was working at UCLA. Because we were focused on the colon bacteria, we decided to focus on these 4 aspects of GI symptoms: distension and bloating, diarrhea, fecal soilage, and constipation. So these were the patients who participated in our study. It was a small study because we were just exploring to see whether there were any differences in the bacteria in these patients. So the average age was about 50 years old. The majority of patients were women. You can see that there was 35% Hispanic, 53% Caucasian. 35% of patients had diffuse disease, and the average disease duration was a little over 6 years. And very few patients in the study were using any kind of immunosuppression like prednisone or mycophenolate. In this slide, it may be a little bit difficult to read, but I'll walk you through it. So this slide is looking at the bacteria that were higher or lower, whether someone had scleroderma or not. So the ones that are associated with the greens bars were actually higher in scleroderma patients compared to the controls, and the one with the red bars were actually lower. And this is published in our paper, so if you want a better copy of it, I can give you a copy of our paper. But one thing that was interesting and what I've highlighted in red there, these are some of the bacteria that were lower in Scleroderma, and these bacteria we consider commensal organisms. So these are bacteria that we think protect against inflammation, and they were actually lower in the Scleroderma patients. Conversely, there were some bacteria that were higher in the Scleroderma patients, and these are bacteria that we consider are pathogenic. They're bacteria that in other disease states have been found to promote inflammation. And then a very interesting finding that we were not expecting were two organisms, Lactobacillus and Bifidobacterium, were higher in the patients with Scleroderma. Now, some of you may take probiotics, and you may read the label of your probiotics, and it says either Lactobacillus or Bifidobacterium. These are actually the two most common types of bacteria that are in probiotics. So we were surprised that the Scleroderma patients actually had higher levels of these organisms. And this, to me, suggested that maybe the probiotics that are out there now, they might not be great for a patient with Scleroderma. We actually don't know. But when we looked at the sigmoid part of the colon, so a little bit further along the GI tract, we found similar findings. So lower levels of the bacteria that protect against inflammation, higher levels of bacteria that are known to promote inflammation, and then once again we observed the higher levels of Lactobacillus and Bifidobacterium. So this to me suggested that there was an imbalance. And so in medicine, when you have a higher level of these pathogenic microbes and lower levels of these healthy commensal microbes, we call this dysbiosis. And this is what we think leads to the development of a number of autoimmune diseases, as well as other diseases too, such as obesity and diabetes. In addition to the imbalance in the bacteria, we also were able to pinpoint certain bacteria that were associated with having more symptoms. So I apologize, the names for bacteria are kind of long and hard to pronounce, but these ones here, Fusobacterium, Actinobacillus, Actinomyces, Ruminococcus, Doria, and Parabacteroides, the patients who had higher levels of these bacteria had more severe GI symptoms. On the other hand, there were other bacteria that if a patient had higher levels of these, they actually had less GI symptoms. So Bacteroides fragilis, Clostridium, Blaudia, as well as Lactobacillus. So some of the bacteria seem to be protective against having symptoms, and other ones seem to be associated with worsening symptoms. So we concluded from this initial small study that the Scleroderma disease state was associated with a unique GI microbiome, and there were higher levels of these bad bacteria and lower levels of the good bacteria. And very interestingly, these features overlapped with what we see in another autoimmune disease called Crohn's disease. And Crohn's disease is a little bit similar to Scleroderma in that it also has, in addition to inflammation, it has fibrosis or scarring in the GI tract. So then we wanted to ask another question. So we saw this in our patients at UCLA, but are there differences in gut bacteria in Scleroderma patients from other parts of the world? And so I started working with a collaborator in Norway, Dr. Hoffman Vold, and she was interested in the microbiome too. So she agreed to send me samples from her patients with Scleroderma so we could look at them. So we decided to compare the gut bacteria from patients from UCLA in Los Angeles and Oslo, Norway. And for this study, we decided to look at stool samples. It was hard to convince patients to do colonoscopies voluntarily, as you may imagine. And then we wanted to, again, see whether some of the bacteria were more associated with symptoms. So we, again, recruited adult patients from both of these clinics. They had to, again, be off antibiotics and probiotics before we collected the sample. And then we, again, matched them with healthy controls. So these were the baseline characteristics of the groups. So again, the average age was pretty similar. The Oslo patients were slightly older. There was a similar percentage of women. Not surprisingly, in Norway, there was a much higher percentage of Caucasian patients. And again, both groups had very low immunosuppressant use. The last thing there, PPI use, this stands for proton pump inhibitor use. A lot of you are probably on this for your acid reflux or GERD, and more of the patients in the UCLA group were on these medications. These are some other features of the two groups. I don't want to spend too much time on this, but these are sort of autoantibodies. Some of you may have had your doctor test for these, and this again helps us understand the characteristics of the group. What I will point out is that the rate of pulmonary fibrosis or interstitial lung disease was much higher in the patients from UCLA. And in general, in talking to Dr. Hoffman-Vold and looking at the research she does in her country, the patients in Norway appear to have, in general, a more mild form of scleroderma, so they tend to have less severe pulmonary fibrosis than what we see in Los Angeles. So again, this slide is comparing the scleroderma patients to the healthy controls. And what we found, the red bars were those that were increased in scleroderma, and the blue was decreased. And I've underlined the ones that we found in our prior study. So things like Fusobacterium, Ruminococcus, Akkermansia, these were all higher in patients with scleroderma, and these are what we consider to be the bad bacteria. And then things like Bacteroides and Fusilibacterium were lower in the scleroderma patients. And this was the UCLA group. When we looked at the Norwegian scleroderma patients, it was actually interesting. There were some differences between the Norwegian scleroderma patients and the healthy controls, but there weren't as many differences. And when we looked at the overall composition, it wasn't as different from controls. And to me, this was a really interesting finding, because if the disease of scleroderma is more mild in the Norwegian patients and they have less gut dysbiosis, this again reinforces that maybe this dysbiosis is a really key part of scleroderma. So now I've spent some time going to other scleroderma centers in the world to try to get them interested in doing microbiome research, because it's a new area in our field. So I've been to Sweden and Italy, and these groups have also looked at their own scleroderma patients. And so I wanted to summarize what all of our groups have found over the last couple of years. So Lactobacillus is something that seems to be higher in almost all patients with scleroderma. And interestingly, a lot of studies link Lactobacillus with motility, so how fast the GI tract moves. So this may be a really important thing to look at in the future for research studies. And then these were other ones that were increased in scleroderma, so Ruminococcus, Akkermansia, Bifidobacterium, and Blaudia. And then there were ones that across different studies were decreased, Clostridium, Bacteroides, as well as Fusilibacterium. So this is a lot of science information, but I thought it would be a good segue into then talking about nutrition. Because in terms of the microbiome, there's really all different ways that the bacteria in your gut are affected by external factors. So beginning from how you were born, okay, if you had a vaginal delivery versus a C-section, this actually affects the composition of your microbiome. Whether you received breast milk or formula affects the composition of your microbiome. It starts from a very early age. It's affected by your parents' microbiome. It's affected by the pets you were exposed to as a kid. So you form this microbiome when you're a child, and then various things happen over the course of your life that probably affect it more, such as going on immunosuppression, like mycophenolate or receiving cyclophosphamide. It could be affected by getting tons and tons of antibiotics. So there's a lot of things that affect it, but diet can actually affect it to a profound degree. And it's one thing that actually you can modify, right? So you can't go back and change how you were born or whether your mother breastfed you, but you can change how you eat, and that's something that's very much in your control and could really help improve your symptoms. So there's now a lot of data looking at how you eat and how it affects the microbiome. And there was a very interesting study that was done looking at large groups of patients all over the world. So they sampled the microbiome from 2 countries in Africa, as well as an area of Venezuela. And this was supposed to be a corn emoji, but I don't know if it came out very well, just to represent that these were areas where the patients that lived in these areas ate more high vegetable diets. So it was mostly plant-based diets. And they actually had higher levels of a bacteria called Prevotella. And this is a bacteria that tends to be higher in vegetarians. And then they compared it to patients living in the US, where here we predominantly eat a high animal protein diet with saturated fats. And this was supposed to be a hamburger emoji. It looked different on my Mac. And again, in the US group, the composition was profoundly different. And then when they tried to compare directly, they looked at all the factors. They looked at the patient's age, their gender, their ethnicity, and even their genetics. And when they looked at all these factors, the diet actually played a more important role in determining their microbiome than any of those other factors. So it's really a key part of the bacteria in your gut and the different composition. So when you make a change to your diet, this can actually have a big effect on your microbiome, and it can actually happen really early. So there was another study that was done looking at the gluten-free diet, and some of you in the room may do a gluten-free diet or you've heard of it. And it's not something that I recommend for every patient, but some people do better when they eat gluten-free. So this study looked at patients who went on a gluten-free diet for 4 weeks, and they measured their microbiome right before they went on the diet, then 4 times during the diet, and then 4 times afterwards. And what they found that was in a few days of changing to a gluten-free diet, there were significant shifts in the bacteria in their gut. And then interestingly, when they resumed their regular diet, eating gluten, everything went back to how it was before. So what this tells me is that the changes can happen quickly if you make a change to your diet, but you have to stick with it, right? If you change back, then things are just gonna shift back to how they were. Now, that doesn't mean like one day a week you can cheat a little bit, but if you really wanna experience a change with how you feel, you're gonna have to try to be consistent with your diet, and the science supports this. What about a plant-based diet? So this is something that a lot of patients ask me about, and I've been vegetarian since I was 10 years old, so I don't support a plant-based diet for everyone, but I will say that for patients with autoimmune disease, not just scleroderma, a lot of people feel better when they eat more of a plant-based diet, less animal-based. So there was a study done that actually had patients either get randomized to eating more plant-based or eating more high animal protein. And it was very interesting because the group of patients that were put into this group of eating high animal protein, well, these patients had the biggest shifts in their bacteria, and they had much higher levels at the end of the study of these bacteria that we think cause inflammation. And interestingly, in this study, there was a patient who was a vegetarian, and she unfortunately got assigned to the animal protein group. I don't think I could have done it, but she did it. And it was interesting because when she started to eat more animal-based protein, her Prevotella, the bacteria I remember I told you was associated with eating more plants, it went down over the course of the study. So it happened so quickly, and this was only a diet they did for 1 week, and within 2 to 3 days. So this was a really landmark study. It was a Nature article, and to me, again, it suggests that the changes that you make with your diet can have a huge effect on the bacteria, and these changes occur pretty rapidly. So the last part of the talk is going to be dedicated to talking about what kind of dietary modifications you could consider making to help your scleroderma. And it's hard to talk about this in a general sense because when I work with my patients on their diet, it's very individualized. I mean, your nutrition is something that's so personal. It's not just based on your health, but it's also based on your culture, it's based on your role in the family. Do you have children to feed, a husband to feed, a wife to feed? All these factors affect what you eat. And so when I work with my patients on diet, we consider all these factors. But I'm going to try to present some general things that could help you moving forward. So the first thing that I want to emphasize is that there's no single diet that's right for everyone. And I think this is really important. I love that now in scleroderma and a lot of other rare diseases, there's a number of resources out there online and support groups and blogs where people talk about what helps them. And I think this has done a lot to raise awareness. But sometimes I worry that there'll be a patient that says, well, I do this diet and this changed my life, and then other people get discouraged because then they try the same exact diet to the T and it doesn't help them. And I think it's something to keep in mind when you read on the internet about a diet that maybe has helped one person. You just take it with a grain of salt. And like, maybe it'll work for you, maybe it won't, but don't be too hard on yourself if it doesn't work out, because there's no one diet that works for everyone. And again, what works for one patient may not work for you. So there's a lot of people that publish books on the autoimmune disease diet and all these different things. And I mean, the further along I get in my medical career, the more I realize that every patient is so unique and everyone is on their own journey. And I don't think I could ever write a book saying everyone should eat this way, because it just wouldn't apply to everyone. So again, you can read books, and I encourage you to learn more. But again, take it with a grain of salt, because if a person you've never met before is telling you how to eat, not all their recommendations might not suit you. Okay? The other thing to keep in mind is that what works for you now may not work for you in the future. And this means that you may be tolerating certain foods now, and down the line they may not agree with you. Or on the other hand, right now you could be like, I can't have any dairy, it causes so much bloating. Then maybe 5 years from now, when you're off your immune suppression or something, maybe you can introduce a little dairy. And so it's really important to pay attention to how you feel, because these feelings will help guide you. So I think the best approach is to listen to your body. And there are some common things that you could do that I think apply to virtually everyone, okay? And I don't say many things that apply to everyone, but this is something that I feel is important. So I would try to avoid processed foods. So processed foods are basically foods that have a lot of ingredients. And if you're looking at a label, which I encourage you all to do when you buy your food, and there's more than 5 to 10 ingredients listed, and half of the ingredients you can't really pronounce the name, I might avoid that, right? Because these are mostly preservatives meant to lengthen the shelf life of the product, and your body doesn't know what to do with them. And there's evidence that some of these things can interrupt the hormones in your body, which also affects your immune system. So I would stay away from those foods. You know, you want to be eating things that have an expiration date that's not 2 years from now, that's more like 2 weeks from now, because this is going to be things that will nourish you better. I think you also want to avoid foods with added sugar. So this is one thing that most of all my patients tell me, is they're very sensitive to things with added sugar. They know right away. Their arthritis will start flaring, they'll get brain fog, they'll have problems with their GI tract when they eat a lot of high sugar foods. So every once in a while it's okay, but I think this is again related to the gut bacteria. There's a lot of bacteria that can proliferate more when they're in a high sugar environment, and those are usually the bacteria that you don't want in your gut in a high abundance. The other thing would be, and this does not apply to everyone, is to avoid raw vegetables. And again, this doesn't apply to everyone, but if you're a patient with scleroderma and you have a really big problem with the motility of your gut, meaning you have a lot of problems with constipation and bloating, I would consider cutting back on your raw vegetables. If you have a big salad before you go to bed at night, you're going to have a lot of trouble sleeping and you're going to have more distension. As the gut moves more slowly, it's harder, and these things, if they're not digested properly, they sit around in the gut and they ferment, and this produces a lot of gas. So I think cooking your vegetables, you can do soups, pureed vegetables, steamed vegetables, roasted vegetables. These are all ways to make sure you get all the good vitamins and nutrients from vegetables without having to worry about eating something raw. So you don't need to avoid raw vegetables completely, and again, this doesn't apply to everyone, but it's just something I've noticed, especially in my patients who have a lot of problems with distension and bloating. And these are a couple more things to consider, and they may seem very basic, but it actually can be problematic when you don't do these things. So I would try to eat more of your meals at home, and I know this is not always possible, right? We're all busy, we have work, we have responsibilities, we're in traffic. But I think it's important that the majority of the time you're eating your meals at home, because then you have a lot more control about what you're eating. If you're going out to a restaurant or you're having fast food, this food usually has a lot more added salt, sodium, and a lot more added sugar. Also, if you're eating like a salad at a salad bar, you don't really know how well that lettuce has been cleaned and who else has been touching it. And so I think especially if you're going to have raw food, you should try to do it more at home where you're in control. Another thing that's important, and again, this may seem trivial, but take your time chewing your food. Okay, the beginning part of digestion actually happens in your mouth with mechanical digestion of the food. If the food isn't chewed properly, there's no chance for your small intestine to extract all the nice vitamin and nutrients from it. And when you have scleroderma, you can have problems with your mouth. And some of you probably have to go to the dentist a lot to deal with these problems. And it can make it harder to chew certain types of food. So keep that in mind. If you're eating something that you know you can't chew well, you need to either avoid it or to try to prepare it and cook it differently so that you can chew it properly. So I know it seems basic, but again, it's going to give your body the best chance to absorb the nutrients that it needs from whatever you're eating. And then I would also recommend try eating when you feel relaxed. So the whole way the body is designed is that to do digestion, you need to be in a parasympathetic nervous system state. And what this means is that your body needs to be relaxed. Okay, you've probably all heard of the fight or flight response. This is our stress response for when we're in danger. And when the body's in that sort of stress response, it's called a sympathetic state. All the blood is going to your heart and it's going to your muscles so that you can act and do whatever you need to do to escape from danger. But the problem is when we're in that fight or flight response, when we're driving in traffic and upset or having a stressful situation at work, we have that same reaction. And if you try to eat when you're in that state, you're not going to digest your food well. Your body is meant to digest food when it's sitting quietly and relaxed. It's not going to digest food well when you're running away from danger. So just keep this in mind. It's not going to be possible all of the time, but if you have the choice, if it means waiting a half an hour till you can calm yourself, center yourself, I would do that over, eating in your car or eating right when you get home and you're stressed about your day. Again, it's something to consider because when you have scleroderma, you're at slightly more of a disadvantage in terms of being able to absorb all the nutrients from food. So you want to do whatever is possible to maximize your experience. So one thing I think that's helpful is try to eat in a relaxed state. Other things would be, and again, we kind of touched on this, consider a plant-based diet. And I say this because of all the diets out there, and I know a lot about all of them, the paleo diet, ketogenic. The plant-based one is the one that universally tends to help most of my patients, okay? And there's a lot of other benefits, too, in terms of the benefits on your heart, so reducing your risk of heart disease. There's benefits for the environment. So if you were going to try to make one change when you go home after this meeting, this is one thing that you could consider doing. The other thing that I strongly encourage is to start keeping a food diary. How many of you have done a food diary before? Good. So this is basically like getting a notepad, like the one they gave you in your packet, and writing down every day what you eat. And you got to do it as you go along because it's really easy to forget what you eat. I can't even remember what I ate yesterday. So you do it every day. And then at the end of the day, you think about how you feel. And you think, okay, how does my stomach feel today? What was my energy like today? Was I thinking very clearly? How did I sleep the night before? And then you just write it down. And after a couple weeks of doing this, you start to try to make connections. And you look at the days where you had more bloating or more fatigue, and you look at what you ate on those days. Did you have more sugar that day? Did you have a lot of dairy? And it's one way to just kind of gain insight into how certain foods make you feel. It might not give you all the answers, but sometimes you're like, wow, like I didn't know I couldn't tolerate peanuts, but it looks like every time I have peanuts, this happens. So again, you start tuning into how you feel, and you really let your body be your guide. And only you can do this, right? Your doctor can't tell you what you can tolerate. I mean, you can have a bunch of food allergy testing, it can all be negative, but you can still have problems with certain foods. So I wouldn't rely on tests alone. There's a lot of tests out there that some of you may have done. They're quite expensive. They're not even really used much in clinical practice, but people will try to sell you these things. But I'm telling you that your best guide is yourself. So if you start to really develop a relationship with yourself and how you feel, this will be your best guide in terms of determining what foods are best for you. And the other thing that you could consider was starting an elimination diet. Who here has heard of an elimination diet? Oh my goodness, so a lot of people have. So this is one approach. Let's say you do the food diary when you go home from here, and you're like, maybe it's dairy, but it could be gluten, or maybe it's soy. It's not really clear. An elimination diet is basically eliminating all of these foods at once for a period of time. And you really want to do it for a good amount of time to give your body time to feel how this feels. And so you could do it for about 4 weeks. And then at the end of the 4 weeks, you add back just one of the things that you eliminated. Because you want to add back one at a time to really determine, okay, is it the dairy or is it the soy? Okay? And these are some of the common sources of food intolerances that people have. So dairy, gluten, grains, sometimes it's nuts, sometimes it's seeds, sometimes it's nuts and seeds. Yeast can be problematic for some people. Soy, caffeine is not great in general for reflux. Sugar, citrus foods, eggs, processed foods. The other thing is nightshades. Some of you may have read about nightshades and sort of the relationship with arthritis. There are some people that feel like if you eat nightshades, and those are basically peppers, tomatoes, eggplant, it can flare arthritis, but it doesn't do this for everyone. So you could consider doing all of these or some of these at a time, depending on what your diet's like. I would do it working with a nutritionist or working with your doctor and going through this process. And it's a little bit tedious, but if you're able to pinpoint the thing that's keeping you up at night from bloating, that's keeping you from enjoying your day, you will thank yourself in the end of going through this process. Okay. The other thing that I wanted to talk about was probiotics, because this is something that people commonly ask me about. So the probiotic industry in the US is huge right now. And you go into any grocery store, and most of them now have a whole section dedicated to probiotics, right? And some of them are extremely expensive. And so you need to understand, okay, well, what is the benefit for me? So there's really only been one good high-quality study in scleroderma. It actually came out this year, and it was done on about 70 patients with scleroderma. And half of the patients got an oral probiotic, and the other got placebo, which is the fake probiotic. And they looked at the patients over the course of 2 months, and what they found was that at the end of the 2 months, there was no difference in the symptoms of patients who were on the probiotics or not. They also looked at some inflammation markers in the blood, and there was only one that was slightly different at the end of the study. So what this tells me, and what some of our research has shown, is that maybe we don't have the right probiotic yet for scleroderma, right? Because in our studies, we had higher levels of Lactobacillus and Bifidobacterium in our scleroderma patients. And if you're taking a probiotic that just has that in it, maybe you're not getting benefit. So what we're hoping is that through more microbiome research, we could identify the bacteria that are low, specifically in most patients with scleroderma, and then design a probiotic that basically is tailored to this disease. And that's the goal. I personally feel like the probiotics that are out there now, they're not specific for scleroderma. They're really not specific for anything. So I would just exert caution. If it helps you, there's really little harm in taking it. But if it's not helping you, it might be better to use that money on buying organic vegetables, because I know some of them can be real expensive. The other thing is prebiotics. Has anyone heard of prebiotics before? Right, so these are substances that are in food that actually naturally increase the growth and the proliferation of the healthy, good bacteria in your gut. So it's a kind of more gentle way to get the probiotic effect. So these are some examples of prebiotic foods. And not all these foods you may have access to, or you may like, or you may tolerate. But if you're able to incorporate a few of these foods into your diet, it may help you. So jicama is one, asparagus, Jerusalem artichoke. And there was actually a really interesting study that was done in animals where they gave some of the animals artichoke to eat, and the other ones they gave a really fancy probiotic. And actually there were more gut bacterial changes in the animals that ate the artichoke than the fancy probiotic. So again, you can do a lot with your diet. That's probably more powerful than taking a supplement. Onion is another one, but some people have sensitivity to onion, so I'd be careful with that. Dandelion greens, garlic, again, that might be something you might be careful with for some people. Leeks, acai powder, and chicory root. So there's other sources of prebiotic, but I wanted to show the ones that have the highest content. And I think, jicama and asparagus are probably two that are most popular that you might want to consider putting in your diet. So I wanted to summarize that, again, GI symptoms occur in most patients with scleroderma, and changes in the bacteria in your gut may contribute to these symptoms. Nutrition and how you eat seems to affect the gut bacteria more than any other factor, right? More than genetics, more than your age, more than your gender. It's really about what you eat. And it's, again, unlike your gender, unlike your age, all these other factors, you have a lot of control over what you're eating. So this can actually be really empowering when you're on your journey with scleroderma to explore making changes that could directly help you. I wanted to leave some time for questions, and I wanted to thank some of the organizations, including the Scleroderma Foundation, who have supported me in the research that I do. But most of all, I wanted to thank all of you for being here and for listening. And I want to thank my own patients, because if they weren't the ones to tell me about how they feel, I would have never started this research program looking at the microbiome and scleroderma. So I'd really encourage you as patients, when you go back home and you go back to your doctors, really speak up about how you feel. It's okay to talk about your GI symptoms, even the most private ones. This will help you as a patient, but it also could help more research in this area and spark some new ideas to discover new therapies in the future.